Okay, so I want to go over this paper called A Typical Presentation of SARS-CoV-2 Infection in Male Genitalia. And there's actually some really good news here. So one of the good news, uh, bits of good news that was in this paper was that this particular case, or this person who had his sperm tested, at least while he was still recovering, it appears as though he still had sperm motility, right? He still had the ability, or he was still fertile, I guess would be the word to describe it. So this is good news that even if you have these clinical testicular issues after you've contracted SARS-CoV-2, that at least during that small time frame, you are still fertile. Okay, so without further ado, I think I'm going to go through this. So, during the novel coronavirus 2019 pandemic, patients usually present with several reports showing symptoms of severe systemic or respiratory illness, and although rare, some genital complaints such as scrotal discomfort can be seen. Rare. Rare where it's up to the clinical level. Now, that doesn't mean that there aren't, so subclinical, there might be a lot more people who have subclinical problems, but at least the clinical problems, those are rare. Anyways, in the majority of patients, however, genital complaints seem not to be the initial or sole symptoms. So in this article, we report an unusual presentation of a male case with severe external genital pain, which was suspected to be the first clinical sign of COVID-19. Now, granted, what I also got to mention is um, there have been other cases of people who have been showing orchitis or inflammation of the testicular tissue, or I think in Brazil they saw that it was present in one of the children that who contracted SARS-CoV-2. So regardless, it's rare that it gets up to a clinical presentation during this acute phase. Now, this doesn't say anything about long-term chronic problems, but at least in the acute phase, it's rare. So, introduction. After the first report of SARS-CoV-2 infection in late December 2019, the scientific community diverted its attention to impact of this virulent virus on the whole organs system. I should also mention that these authors are from Turkey, so might not be their syntax is going to be fixed in following revisions of this particular paper. And anyways, involvement of male genitourinary system as a potential target was also reported in the literature. So there is a very limited number of data regarding effects of COVID-19 on fertility. Nonetheless, patients with COVID-19 are recommended to be followed in the long term to reveal any deleterious effects of this infection on the male reproductive system. So Italy, a lot of Italian scientists and doctors have been worried about this, or at least they've been publishing more frequently. So I believe that the Chinese and the Italians have really been on top of this as far as making, I guess, publishing and writing papers regarding their fears about the male genitalia system. Anyways, which is also an interesting topic to be debated for many researchers. Anyways, in this article, we report an unusual presentation of a male case with severe external genital pain, which was suspected to be the first clinical sign of COVID-19. So this person, his first sign of contracting COVID-19 was this severe external genital pain. So he got this before he got other clinical symptoms. So here's a case presentation. A 49-year-old single male patient was admitted to our urology outpatient clinic with swelling sensation and pain in his left groin and testicle. Okay, his symptoms started early on the day of hospital admission, and he had intermittent pain initially. However, its severity increased over time within 3 to 4 hours before his admission to the hospital. So he was first going into this, he went to the urology outpatient clinic with the pain, and eventually it became worse and worse until they had to actually hospitalize him. And this pain was radiating to his left inguinal area, and I'm not exactly sure what that is, but we can just Google it right now. So that, let us go to, so find inguine. So in the groin, the adjective as inguinal. So this would be the inguinal area. So that, yeah, that was the groin area. So his left groin area, and it was reaching up to the left flank region, the patient had no lower urinary tract symptoms. So that would be one of the things that the physicians would do, is to figure out what the heck's going on. They would run a panel of different tests to try to figure out what kind of disease or what kind of pathology is going to be generating those symptoms. And so you basically will knock possibilities out by running these tests. And apparently, not only with the test, but you would also use symptoms to help guide your decision of what test to do. And here they said there was no lower urinary tract symptoms. So his medical history revealed hyperlipidemia, so having too many lipids in his blood, and insulin resistance without any previous surgery. So probably some diabetes, probably an unhealthy diet in some way. Regardless, he's only 50, so he still should have decades left in his life. His physical examination showed normal vital signs at the time of presentation. Genital examination revealed left spermatic cord tenderness and pain. So the left spermatic cord looked to be, or I guess while they are touching that area, the patient probably, what would the word be, showed very serious discomfort, or they expressed discomfort. And so that was going on, and there was pain on palpation without any abnormality overlying scrotal skin. So after a suspicious contact history in a emergency department 2 days ago, he was screened for COVID-19. Okay, and a pharyngeal swab sample was taken for the quantitative reverse transcriptase polymerase chain reaction, or qRT-PCR analysis. So the patient was sent home in self-isolation and was instructed until test results were obtained, and the result was reported positive on the day of admission to our urology outpatient clinic. So laboratory analysis showed mild leukopenia. So leukopenia is when the leukocytes, or white blood cells, are too low. So a low white blood cell would be low leukopenia, or I should say it would be leukopenia. And then he also had some anemia. So his hemoglobin levels were too low, and I wouldn't be able to tell you what the normal hemoglobin levels are supposed to be. And he also had normal D-dimer levels. So D-dimer, remember, D-dimer would be a biomarker for excessive blood clotting. And so this person did not have excessive blood clotting, or at least through this particular biomarker, he did not show elevated levels of blood clotting, which is good because elevated D-dimer levels are linked to worse mortality rates. And he also had increased ferritin levels. So ferritin, this is one of the proteins that helps store iron. So it would be upregulated if you, say, had more iron in your diet, or if you had extra labile iron in your body, you would be producing more ferritin. Now, granted, ferritin is supposed to be within the cells, if I'm remembering correctly. Ferritin, and let's biomarker. Yeah, so if you have too much ferritin in your blood, that's a biomarker for some sort of damage, and I wouldn't be able to tell you exactly what it is. I would presume it'd be liver damage because ferritin is highly expressed in the liver, but don't quote me on that. Just know that high ferritin levels is definitely not a good thing. So thoracic computed tomography, or CT scans, revealed no findings of COVID-19. So he did not show any of the lung-related issues. Okay. Abdominal ultrasound revealed small, simple cysts in both kidneys. So yeah, apparently he had some cyst in both of his kidneys. I don't know if that would be tied to COVID-19 or if that would be another underlying condition. There was also scrotal ultrasound that showed a slight increased vascularity, suggesting spermatic cord inflammation with no testicular finding compatible with orchitis. So he seemed to have inflammation of the spermatic cord, but he did not have testicular findings comparable with orchitis. So sorry, potential fraud. So this would be, let's go to the spermatic cord. So this is the cord-like structures in males form when the vas deferens and the surrounding tissue that runs from the deep inguinal ring down to each testicle, and it's serosal covering. I don't know what that is. A serous membrane is a smooth tissue membrane consisting of two layers of mesothelium. So there's just a covering. The tunica, okay. I wouldn't be able to tell you what any of this stuff is. So let's just look here to see if there's a spermatic cord anywhere in here. I really wish that if you looked something up. Okay, so here we have our spermatic vein, and here, okay, so this is the spermatic cord right here that runs, looks like with close to the vas deferens. Okay, so that is the spermatic cord, and I wish they had it on here, but it is what it is. So just know that that was inflamed, and there were no testicular findings compatible with orchitis, and orchitis is the inflammation of the testicle itself. So the urinalysis result was negative with nonspecific urine cultures. So testing the urine to see if there's any just UTIs, and that was all negative. And the cultures were collected for sexually transmitted diseases, including RT-PCR analysis for all these different STDs, and they were all negative. And so normally STDs, or oftentimes STDs, might be able to indicate that there is a what's it called? Well, if you have an STD, that might cause some of these conditions or some of these symptoms. However, since he tested negative for all the common ones, then they can say, okay, it must be, or it is unlikely that an STD is causing these issues. So, in addition, the Venereal Disease Research Laboratory Brucella agglutination test and Monk's antibodies were negative, so they looked for different types of diseases. And semen analysis using RT-PCR also produced negative results. Excuse me. Due to his high concern on fertility, semen analysis was performed, and the sperm count analysis revealed no abnormality according to the 2010 World Health Organization criteria for semen analysis. So this is good. I like this sentence right here because this is saying that at least during the time of admission, his sperm cells or his sperm cell count was normal. So this would indicate that he would still be fertile. Granted, he's almost 50, so I wouldn't see much of a reason to worry as much, but there would be some reasons to worry, especially regarding your testosterone or your sex hormone levels, because that stuff is important, especially, or it's important to maintain healthy levels of those hormones. And if when you're in your 50s you end up screwing up your hormone production, that can end up causing some unwanted or unnecessary complications in life. So with that, I won't be able to read this for you, and I should also say I'm not in the medical field at all. I'm just reading the papers that are coming out of it. Anyways, this patient was hospitalized for COVID-19 treatment and was given a standard 5-day regimen of hydroxychloroquine, 200 milligrams twice a day, and azithromycin, and imipenem cialastatin, and I have no idea what that is, so let us look what this is. So this is an antibiotic useful for the treatment of a number of bacterial infections, so it's just an antibiotic of some form, and he was given that 4 times a day. So the hospital course went uneventful with full recovery from his general complaints after the 2nd day of treatment. The 2 subsequent RT-PCR tests were positive on day 18 and 13, and after the first positive PCR. So the results were found to be negative on the 4th test on day 18. However, on days 19 and 20, the test results were positive again. So we finally obtained 2 consecutive negative RT-PCR results on days 22 and 24. This is indicating that the viral shedding took longer than 3 weeks. So they kept on testing him. They were able to get a negative test once, but then they had to, do more to make sure that that was a true negative, or perhaps the virus was the virus was suppressed momentarily and then ended up re-emerging because it was able to sort of outfight the immune system for a little bit longer. So things like that seem to be happening very frequently with this particular disease. So a written informed consent was obtained from the patient for all the diagnostic and therapeutic procedures performed. So here's the discussion. Based on a current body of scientific knowledge with diverse case studies on COVID-19, it becomes clear that the virus can express itself differently on a case-by-case basis. So in its nature, the COVID-19 is a viral infection which predominantly attacks respiratory organs. Um, well, I would say it gets in through the respiratory organs, but what organs it ends up screwing up is that's all over the place. However, as in our case, patients can exhibit various symptoms in organs other than the lungs, such as in the genitals. The presence of ACE2 in the testes, the Leydig, and the Leydig, these are the hormone-producing cells, and the Sertoli cells, these are the nursing cells of your developing sperm cells. So these are all of these are very important for proper what would the word be? Proper fertility health, right? And receptor for entry, these all have the ACE2 receptor for entry into target cells by the SARS-CoV-2. Now, granted, ACE2 might not be the only receptor that the SARS-CoV-2 virus will be able to infect, so there is some indicator that SARS-CoV-2 would be able to get into cells that have the FC receptor, where the FC receptor is it's the receptor that binds to the tails of antibodies. So there is some concern about antibody-dependent enhancement, where if you develop antibodies against this virus and they aren't good enough to neutralize it, then the virus can end up sticking to the FC receptors, and then that would be a new way for the virus to infect those cells. And then there's also the CD147 cells that are of some concern, because some immune cells have the CD147 cell or CD147 receptor, and this is what would the word be? It is a receptor that can, at least with the original SARS would bind to cyclophilin, and then one of the nucleocapsid proteins of the original SARS was able to bind with cyclophilin, and then cyclophilin binds to CD147, and then that entire complex could also make the cell vulnerable to the original SARS. Now, there have been some reports that not the nucleocapsid protein, but the spike protein in of itself in SARS-CoV-2 is able to bind to the CD147 receptor, which is insane. So if that is true, that the spike protein is able to bind directly to those CD147 receptor, that could be very problematic as far as what cells have become vulnerable or are potentially vulnerable to SARS-CoV-2. Regardless, we're still running under the presumption that the ACE2 is the majority of, or what would the word be? The most common receptor that is targeted by SARS-CoV-2. Anyways, this suggests a high suspicion of involvement in male gonads, although there is no clinical evidence available to date. So here is the issue: is there's a lot of the stuff is subclinical, in that if you do not show or present significant symptoms in a particular area, your physician might not even care to look at that area. So especially if they have if their attention is being diverted to other more pressing organs of the body that are being more highly damaged. So subclinical hypogonadism, or subclinical low activity of the gonads is epidemic. There are a lot of people right now who have low functioning gonads. However, they're not so low functioning that they even notice that they're low functioning. And so they don't go to a urologist, or they don't go to their physician to check out their balls, because they don't believe that there's a reason to. And so because of that, there's actually a dearth or a paucity of information regarding the subclinical hypergonadism. So with that, just know that in the context of this pandemic, there really could be a lot of undiagnosed subclinical hypergonadism that is going to only get progressively worse as time goes by. Anyways, one recent study reported that COVID-19 could induce damage to male reproductive system hormones, and this was this particular study number 4. So the effects of SARS-CoV-2 infection upon male gonadal function. And remember, this was not peer-reviewed, so I don't know if it will end up becoming peer-reviewed. It might not have enough impact for it to go through that peer review process. Regardless, the effects of SARS-CoV-2 infection upon male gonadal function showed that there was a really statistically significant decrease in male sex hormones in COVID-19 patients, and then it correlated with severity of disease. So this suggests a high suspicion of involvement in male gonads, although there is no clinical evidence available to date. One recent study reported that COVID-19 could induce damage to male reproductive system hormones. So, and this was this paper. Oh wait, yeah, I read that already. So in this study, the authors compared sex-related hormones between 81 reproductive aged men with SARS-CoV-2 infection and 100 age-matched healthy men, and found that the serum luteinizing hormone significantly increased. So luteinizing hormone, just know that that's a type of gonadotropic hormone. So your hypothalamus produces a lot of hormones or a lot of proteins that end up getting processed into these peptide hormones. These peptide hormones then get transported through the axons of the hypothalamus into the pituitary gland, and the pituitary gland is actually storing a lot of these hormones within it. And then, given the right signal, it releases these hormones. And there's actually a lot of different axes for different target organs. So this luteinizing hormone is a part of the hypothalamo-pituitary gonadal axis, okay, or I believe it's the HPG axis. And so this luteinizing hormone and the follicle stimulating hormone, which is another gonadotropic hormone, those get released and they will act upon the gonads. And one of the targets within the gonads is the Leydig cells. And the Leydig cells are going to be producing the sex hormones, such as testosterone, right? Or the other types of steroidal hormones. And so those steroid hormones then cycle back and then self-regulate the release of this luteinizing hormone and follicle stimulating hormone from the pituitary gland. Now, this is a self-regulating cycle, and then it cycles. There are ebbs and flows to it. Now, with this particular paper, they showed that there were statistically significant high levels of luteinizing hormones in these patients, and then the testosterone to luteinizing hormone and follicle stimulating hormone to luteinizing hormone ratios, those were significantly decreased in males with COVID-19. So basically what we're getting from this is that there is a really, the hormones are being screwed up in some way. And the testosterone to luteinizing hormone ratio is lower than what it is supposed to be. And then same thing with the follicle stimulating hormone to luteinizing hormone. So basically, this is coming in and it's somehow screwing up that hypothalamo-pituitary gonadal axis. So, and that could be through attacking the pituitary, that could be through attacking the hypothalamus, that could be due to attacking the testicular tissue, that could be due to a number of things, right? And like it could be due to a fever, you know? So anyways, this findings provides a good evidence on the influence of medical conditions of COVID-19 on male sex hormones, taking more attention to gonadal function of patients recovered from SARS-CoV-2 infection, particularly for reproductive aged men. Although these findings are preliminary, urogenital system may be in a potential risk to be infected by SARS-CoV-2 infection. Genital complaints such as scrotal discomfort were reported in 19% of patients around the time of their COVID-19 confirmation in the PAN and other studies. Really? Really? Okay, so so this was the paper that showed that I don't remember that. I don't believe it was peer-reviewed yet, but this was the paper that showed that you could not detect SARS-CoV-2 in the semen of a lot of patients, which was really good news, because if it is found in the semen, that could indicate that the virus can live in the immunoprivileged site of the testes, or within the testes, and if it can do that, then it can evade the immune system for a very long period of time. So, but this same paper also said that 19% of patients confirmed, uh, said that they had some scrotal discomfort, and that could be from the blood clotting, that could be from the virus actually attacking that area, that could be from an autoimmune response. So I really should read into that a little bit more. But one thing that I wish that he said, or how to phrase it, I wish this is this 19% of all patients, or is it 19% of men, right? So um, yeah, I'll have to look into that. So in our case, the patient had no other systemic or urinary symptoms in addition to testicular, spermatic cord pain, and swelling sensation. Furthermore, viral clearance took longer than the mean clearance time of pneumonia. So this person seemed to have been testing positive for far longer than what would normally be expected. Anyways, any illness with fever may have deleterious effects on spermatogenesis temporarily, as it was shown in previous studies. On the other hand, we cannot be sure that COVID-19 would follow the same pattern. Therefore, the case study reflects that COVID-19 would be a potential target to male genitalia directly, or may potentially target male genitalia directly without affecting any other organ systems, and systemic symptoms should be closely followed. Although listed symptoms and concerns do not fit the mold for COVID-19 symptoms, our case suggests that it is possible for patients with genital pain and discomfort to be infected with the virus. So in conclusion, patients with isolated genital symptoms such as testicular or spermatic cord pain and discomfort without other systemic symptoms should be closely followed for COVID-19, and clinicians should be alert for this unusual presentation of the virus during the pandemic. So this is, I mean, this is worrying me a little bit. So I don't know where the spermatic cord is exactly, so I wouldn't be able to tell you whether or not it's uh, in the or on one side of the blood testes barrier versus the other. I'd assume it'd be outside of the blood testes barrier. However, I would not be able to tell you any of that at all. Just know that there seems to be some sort of clinical presentation, at least in a subset of people, where their only symptom is the urinary urogenital system discomfort. So with that, this does concern me, because this means that COVID-19 very well or could easily be transmitted sexually, even if there are no pneumatic or pulmonary problems that are obvious. So yeah, this is slightly concerning. Now, granted, good things not found in the semen, so negative semen PCR tests, and then also his swimmers were pretty good as well. So the numbers of the swimmers were pretty good. So this indicates that at least for that period of time, he still had how do I phrase that? He still had functioning sperm development. Now, granted, how long for a germ cell to turn into a sperm? Okay. So it takes 74 days, though. It takes 74 days for a germ cell to become a sperm cell, right? So, I mean, I'm a little concerned that, while you're still in the acute stage of contracting COVID-19, you still very well could be just producing or releasing the sperm that have already been generated, and the sperm themselves are, they're probably not the initial target. What would concern me is that, say, if the germ cells that end up becoming the sperm cells, if those are being attacked, because those cells actually have extremely high ACE2 expression, then you would probably not even know that you had a reduction in your sperm count for 74 days after the fact, right? So, granted, I don't know how long it takes to go from an acute testicular disease to seeing the numbers in the sperm cells decreasing. So, yeah, I'm not the person to come to for that. So I'm just concerned bringing this up, but there are some good things in this paper that at least comfort me a little bit. So With that, I'm going to head on out, and thanks for watching. And if you have any questions, please leave them down in this or leave them down in the comments. Thank you.